Hello there. Why is my puppet vomiting and having diarrhea? Welcome to the very messy world of puppet diarrheas. The following 4 disease conditions pop up in my mind each time I'm presented with a puppy that is vomiting and having diarrhea. Parvovirus infection, coccidiosis, hookworms, and food poisoning. Dog breeders know how to control the above diseases, and most puppies presented for diarrhea and vomiting are adoption or rescue puppies by new owners. After physical examination, I normally order a rapid snap test to eliminate parvo as the cause of diarrhea and vomiting. If the test is positive, now my challenge for treating parvo and preventing a spread in the hospital have just begun. So what is parvo? Parvo is a highly contagious and deadly virus that affects puppies below 4 months that have not been vaccinated. How is parvo virus transmitted? Parvo is transmitted by direct contact. Parvo can be directed from dog to dog if two dogs reach each other, one with parvo, the other one without. Dog and contaminated saliva or fecal matter. A healthy dog comes across saliva or fecal matter of a dog that has parvo, the dog will get parvo. Dog and people handling parvo-infected dogs. If a healthy dog gets in contact with a person who has been handling parvo-infected dogs, the healthy dog will get parvo. The puppy will get parvo. Adult dogs which are vaccinated are not likely to get parvo because they are already immune to parvo disease. Number 4, dogs and contaminated surfaces and objects like feeding containers. The puppies share containers, and one puppy has parvo is going to get to the other puppy. So what are the clinical signs of parvovirus infection? Parvovirus causes very severe inflammation of the stomach and the intestines, or gastroenteritis, and all the clinical signs are linked to that very severe inflammation. So, clinical signs number 1, extremely severe vomiting and diarrhea, sometimes tinged with blood. You have abdominal pain. You have lethargy and severe dehydration. You have loss of appetite. Dog is depressed. The dog has low temperature, or the dog is hypothermic. How do you control parvovirus infections? Vaccinating puppies early is the most effective way of controlling parvovirus. Animal shelters vaccinate puppies as early as 4 to 6 weeks of age. My hospital offers early puppy vaccination from 6 weeks of age. If parvo is prevalent in your area, have your puppy vaccinated very early. 3 doses of parvo vaccine spread over 2 to 4 weeks apart are adequate to overprotection for 1 full year. Parvovirus vaccine is available as a combo vaccine or as a single vaccine. What's the treatment for parvovirus infection? There is no standard treatment for parvovirus. All treatments are just supportive care. Beware, even with very intensive supportive care, about 40 to 50% of patients will die from parvovirus. What are the treatment strategies? Strategy number 1, to stop vomiting and diarrhea. Replace electrolytes lost through vomiting and diarrhea. Alleviate pain and control inflammation from the gastroenteritis. prevent parenteral and enteral nutrition to the anorexic puppy. Control any pathogenic bacteria that might take advantage of the puppy's poor body immunity. What's my treatment protocol? Day 1. I would administer ondansetron to control vomiting. Administer diarrhea to control diarrhea. Administer steroid injection to control pain and inflammation. Administer lactated ringer solution with 5% dextrose subcutaneously as parenteral nutrition, hydration, and lost electrolyte replacement. Administer a broad-spectrum antibiotic to control secondary bacterial infections. Dispense 50% dextrose for oral administration every 3 hours until next day. Day number 2 and number 3 are over the same treatment as day 1. Day 4. If the vomiting and diarrhea has been controlled, I will discontinue ondansetron and diarrhea. If the puppy has started eating and drinking water and is not dehydrated, I will discontinue lactated ringer solution and oral dextrose. If the puppy is still depressed, I will administer one more steroid injection and dispense oral prednisone for 7 days. I also continue with oral antibiotic for another 7 days. And that's the end of the video. Now you should know something about the parvo virus. Thank you for watching and see you in the next video.